Now, for the next consideration, which we'll be discussing, is the aspect of bone biopsy in orthopedics. All right, bone biopsy in orthopedics. So we'll look at when it is needed and like how it is done and all of that. So bone biopsy just have to do it. I'm taking some samples of the bone. Yeah, this one I actually talking about the bone to be specific, but some people could also use bone biopsy and interchange it to meaning what bone marrow biopsy. Do you understand? It actually depends. So what we have there is for the bone biopsy, it's a diagnostic procedure. So this one they're actually taking a small sample of bone tissue, you know. So that's what I'm trying to say, that some people can still do a bone marrow biopsy but say it's actually a bone biopsy, you know. So the sample is removed and it's actually what sent to the lab to be examined. So what are the indications? What could actually make you want to do a bone biopsy? If you are suspecting that there's a bone tumor, if you have seen on x-ray that there's a bone lesion and you can't really, you know, identify, you know, it very well, okay, so you might want to like confirm it from the lab, right? It's an unexplained bone lesion. If there's a suspected infection, all those osteomyelitis, tuberculosis, you know, metabolic bone disease, unexplained bone pain or swelling, okay. So types of bone biopsies, you could be defined needle aspiration, all right, core needle biopsies, all right, and often image guided. So as you are trying to take off the samples of the bone, you are guiding it to fluoroscopy, which is like a real-time x-ray on other CT scans or ultrasound. So open biopsy is like surgical procedure. That one is under anesthesia. That one there's a larger incision, of course a larger, you know, sample will be taken for the lab. So technique and approach is, first of all, you have to select the site where you are doing the biopsy. All right, then incision will be planned, whether it will be longitudinal, you know, and all of that. Then aseptic technique, you have to make everywhere so neat because you don't want infections to come in. Then, you know, image guidance, so it's used for deep or complex sites. Then hemostasis, then how to actually stop the bleeding, you understand, so that you basically prevent hematoma formations. So this is the bone marrow biopsy, okay. People could also still say this is a bone biopsy because bone marrow is actually what inside the bone, you know. So clinical application is you can use it to diagnose bone tumors, you can use it to what diagnose infection of the bone, you can use it to diagnose all those cancers that are now spread into the bone, you know. Then also unexplained bone pathology. With a bone biopsy, you can be able to now pinpoint, okay, what a particular issue in a bone is.